Hi, I'm Seth Wolk. I'm the Chief Medical Officer for Spectrum Health System. I'm also the President of Spectrum Health Medical Group. I'm here today with Stephanie Williams. Stephanie is the Division Chief of our Adult Blood and Bone Marrow Transplant Program. Nice to see you, Stephanie.
Thank you.
So you've been here at Spectrum 4 years?
A little over 4 years, yes.
Yeah. So tell us what's happened in the last 4 years in the bone marrow transplant program.
We've had a major growth in our bone marrow transplant initiative. Starting when I first got here in the end of 2012, our clinic opened in November. In February 2013, we did our first transplant, and to date we've done 281 transplants in the adult population. All people from West Michigan, all people who, if we hadn't had this program here, would have had to travel elsewhere in order to have their transplants performed.
We have a new inpatient transplant unit. Tell me about it. What makes it special?
Yes, it's a wonderful unit. It's the Lettinga Cancer, within the Lettinga Cancer Center. It was designed with the help of some of our patients, so it's a very patient-centric unit. A lot of the amenities were put in for patients and their families. It is an 18-bed unit with place for patients' family members to stay, family lounges, an exercise room for our patients as well as state-of-the-art air handling systems to prevent infectious complications, a fantastic nursing staff that is very well trained in terms of taking care of bone marrow transplant patients, and really without a great team around us with nurses, dietary, physical therapy, and pharmacy, we wouldn't be able to take care of these patients, but they do an excellent job.
You talk about the importance of a team. Tell us about some specialty people on your team.
We're really blessed to have a great group of people. We have 3 physicians, 3 advanced practice providers. We have a social worker, 3 pharmacists who specialize in taking care of patients with bone marrow transplantation, a nutrition specialist. We have a physical therapist who will round with us. We have a care manager who helps us with the discharge of our patients. We have 3 transplant coordinators, 2 financial coordinators, and they're extremely important to help these patients, both in terms of negotiating their insurance contracts, but also to help procure and pay for their medications afterwards. In addition, we have in our outpatient facility an infusion nursing suite to help take care of any outpatient needs that our patients have. So it really does take a village to take care of patients, and many of these people have been with us since we've started the program. They're very dedicated towards our patients and to Spectrum, and to making this the best possible transplant program in the state of Michigan and hopefully regionally.
A lot of the people who will be listening in on this interview are physicians, and hopefully who have potential patients. They may refer to Spectrum for this service. Any special thing you'd like for them to know?
So we do have a referral coordinator who will help coordinate any patient who wants either a second opinion about a transplant, who needs a transplant, or who might have had a transplant someplace else but lives in the Grand Rapids area and wants to continue to get their care closer to home. The patients that we see in the adult world are patients with hematologic malignancies, leukemias, lymphomas, myeloma, and then a benign condition called aplastic anemia. So those are the types of patients where transplantation is important in terms of their care. Our referral coordinator can help them get the information together that we need when we need to evaluate these patients, which includes treatment records, pathology reports, hopefully before we see the patients, as well as coordinating insurance referrals that are important for the patient to know that their visits are going to be paid for.
We live in a world of change. What's your vision for the next 5-10 years? Where do you think your program is headed? Where would you like to see it go?
So I think we will continue to increase in terms of our volume in taking care of patients. I think with the work that we're doing, both our clinical trials and the basic research that we're participating in, we will become a regional center of excellence for blood and marrow transplantation, and that we will be a destination site in the Midwest, and I hope nationally, for patients who need to have this particular type of therapy.
As I understand, you're a native of Chicago and a White Sox fan. Am I close?
You're close. I was actually born in Albany, New York, but thankfully we moved when I was about 4 or 5 years old to Chicago. I grew up on the south side of Chicago, and actually my original team that I cheered for the most was the Chicago Cubs, because they were on TV every afternoon when I was a kid. The 1969 Chicago Cubs are my favorite sports team of all time. But having been a Cubs fan and having been tortured for many years, in 2003, after the last round of torture, I decided, well, you know what, maybe I'll get White Sox tickets, and they happened to win the World Series in 2005. So, but this was a great year for any Cubs fan to win the World Series. I can't believe I lived long enough to see that. But yes, I love Chicago, and I love every sports team in Chicago.
And before we started this interview, you were telling me you're headed there this weekend.
Yes.
So when you go to Chicago, what do you like to do now?
So I have 2 grandchildren in Chicago. So I actually spend a lot of time with them. We go to, hopefully tomorrow night, depending upon the snow situation, Brookfield Zoo has the Christmas zoo lights, which we like to go to visit. So we'll just be spending time, and actually have to babysit one of my grandchildren next week. So it's just a chance to spend time with them.
Well, thank you for spending some time with me. I know earlier you said you're contemplating retirement. I hope you are going to continue to work and develop this program for a number of years. Thank you for coming in today.
Thank you for all your support, Dr. Wolk.